Paula, thank you for inviting us to come and talk to you about primary sclerosing cholangitis. Before we get into anything else, you're CEO of the charity?
I'm the CEO of the charity. I've only been CEO for about 8 or 9 months now.
Yeah. And how are you finding the role?
Do you know what? I absolutely love it because I do think, it's such a rare disease, but I do think we make such a difference to people who have it.
Yeah.
We provide lots of information and support, our helpline, our Facebook group, which is fantastic for peer support, people talking to each other, getting support of each other. And we do think that research now, it's a flourishing landscape for research in PSC. So it feels like there's some hope and we just want to push it around the corner to get some really good, effective treatments.
And it's probably worth saying, because I think it's a good example of how rare this is. You don't have primary sclerosing cholangitis. That's fine, because you need people who can run charities to come and help make sure that those people who are effective are getting the help that they need. But it was a new disease to you when you came into this role. I'd
literally never heard of it. Never heard of it. But what was interesting was throughout my life, I'd met 2 people who'd had liver transplants.
Right.
And I hadn't clocked what they'd had because, it just didn't sink into my head. And when I looked back and contacted them again, they'd had PSC. So I had met 2 people with PSC, but I hadn't realised it.
So for anyone who's watching and doesn't know what we're on about, it's worth giving some context near the top of this interview. What is PSC?
So PSC is an immune-mediated liver disease. It affects the liver and the bile ducts. It's not a heterogeneous disease. It doesn't affect everybody in the same way. It's very diverse, but it can be very debilitating. For some people, the symptoms are not there. They don't have many symptoms and they can go throughout their life with that. But for others, they might need a liver transplant. They might, they might get a really serious cancer. So it can be very debilitating. And one of the problems with the disease is the emotional impact. People don't know what the future looks like for them. And
I suppose that piece is something that we'll come back to, because that, as much as anything, especially if you don't have any outward symptoms, is as impactful on a patient as anything. What treatments, though, are there? Before we kind of get into the impact on what it might be or how people are living with this, what treatments are there available for people if they do have a diagnosis?
Well, unfortunately, there are no medical treatments that halt or stop the progression of the disease. When the liver, and it doesn't happen in everybody, but when the liver gets so damaged from this disease, the only treatment, if you can call it that, is a liver transplant. Now, as I said, that doesn't happen to everybody with PSC, but that is the only thing available at that point in time. There are medications to treat symptoms for all liver diseases, such as itch. There are antibiotics for any infections that you might have with your PSC. And you can have some nutritional support as well, because patients with PSC don't absorb certain vitamins in the right way. So there could be that nutritional support. But in terms of a cure or anything to stop the progression, that is not there currently. That is not there currently. But as I mentioned to you, the research landscape is flourishing at the moment. And we're doing everything that we can as an organisation, a patient organisation, to push that research around the corner and to find some effective treatments for PSC.
Now, you'd think that there would be treatments or a potential cure, because liver disease is such a prevalent killer, global top 10 killer. But PSC is a very small subset, and it's not caused by any outward actions of those who have the disease. How many people are we talking about who have this disease?
It is really difficult. There is no set figure in the UK. The NHS do not have a set figure in the UK for people living with PSC. They've said it's anything from 3,500 to 10,000 people. So we're kind of estimating about 5,000 people in this country have PSC, which is tiny. It's so incredibly rare. It's so incredibly rare disease that, in one way, you can understand why there's not an effective treatment, but we are pushing that to make sure that there is one very soon.
In terms of, okay, if there's 5,000 in the UK, PSC support, you're focused on the UK.
We are, yeah.
Right.
We do have people dialing into so we have Facebook Lives, and one of the last ones we did, we had people dialing in from 5 different countries around the world. Somebody from Australia dialed in the middle of the night to hear that information, because I think the information globally is very small. There's not enough information. We had an information day recently. Somebody flew in from New Zealand to Manchester in order to take part. So that's, yeah, we are UK based first and foremost, but we do have people accessing our information, our service, if you like, from all over the world.
And what does that global community look like in terms of, yes, okay, so you're a charity who are there to support the UK population, but I suppose there must be sister organisations, so to speak, in the States, in other countries around the world?
There certainly are. In Australia, there is another organisation, a PSC patient support group. In the States, PSC Partners, they're very big. So there are some, but we do think we provide a lot of good information on the disease. And
you said that you provide information. So there's no effective medical treatments, but you talked about the impact it has on people's lives. What can the charity do to try and help support those friends, family as well, of those who are suffering from the disease when there isn't such a pathway, I suppose?
I think our website provides lots of information. So when people are diagnosed with PSC, like anybody would, the first thing you do is go on Google.
Yeah.
And there's lots of misinformation on Google. I think a lot of people think they've got 5 to 12 years of life left once they look on Google. So that's really scary for people once they are initially diagnosed. And it's not true, actually, what people see on Google a lot of the time. So we provide on our website medically checked by the top PSC doctors, I would say, in the world, actually. Medically checked information, factual information for people to read through. So I think that calms people down and gives people perspective on the disease. We have a helpline that's available for patients, for friends and family to access. And they ring up the helpline and get some really good advice and some emotional support. We've got that Facebook page. It's a closed group, a closed private group on Facebook. But people give each other, patients with PSC and family and friends, mothers of sons, it tends to be, who are on there. Lots of, peer support. And I think that's really important with a rare disease in particular, where you don't meet somebody with PSC in your everyday life, or, somebody who's got PSC in their family, in their everyday life. So we provide that as well. We've just had an information day. So we do information days twice a year. We just had one in Manchester. And one of the lovely takeaways from me from that event was people talking to each other. And we had lanyards. I've got PSC. My friend or family member has got PSC. I've had a liver transplant. If you didn't want to have a lanyard, you didn't have to, by the way. But 2 women, I just remember this conversation between 2 women. One had a 17-year-old boy with PSC, and the other one had an 18-year-old boy. And they were just like, oh, this is wonderful to be able to talk to somebody else who's going through exactly the same thing as I am. So we provide those forums. And also at those events, we have the world's experts on PSC there. Because one of the things with a rare disease is that you don't have, there's not enough PSC experts in this country, medical experts in this country. So you might go to a smaller hospital for your treatment and not have that expert in your disease, somebody who's just knows about it a little bit and is trying to treat you in the best way that they can, but they don't have that expertise. And we want to give patients, the availability of those experts so they can ask them questions and find out the information from them.
You make a good point there, because you reference Google as being misinformation, but it is important to get experts in front of that community as well, because when I initially received the call saying this is what we think it is, the doctor on the phone said to me, you're in your mid to late 30s, let's say mid 30s, I'll be kinder on myself. But they said at the time, get to your early 50s, probably doing well. which is that kind of time scale that you're talking about, where immediately you go, hang on, what? Sorry? And that's coming from a member of the medical community. So I suppose that contributes to that feeling of a slight lack of control for patients, right, until they get the opportunity to talk to someone who is actually an expert in the disease.
Yeah, definitely. We have these things called RC Experts every month on Facebook. It's like a Facebook Live. And people, we're just overwhelmed with questions. So there are some really good PSC experts in this country, but people don't have access to them. Most people don't have access to them because they're not at their hospitals. So we're putting them in front of people, and you can ask them any question you want to. And it's a really good forum to get those expert answers. And what patients then have to do for themselves, unfortunately, is advocate for themselves. So go back to their clinician and say, this is what I should be having. I should be having these treatments from you. I should be having these investigations, from you, every year or every 2 years or whatever it is. So it's really good information. And we've had some great feedback of what we can provide. And I think what we're also doing is pushing the medical community to keep PSC at the forefront of their agenda. We do provide research funding. So we provide a pot of money for researchers and clinicians to research PSC. We're going to increase that this year and subsequent years. We want more research. We want to push that agenda and get a PhD fellow as well to really do some deep work over the next 3 or 4 years, day in, day out, and investigating this disease. And we think actually they might have one thing on their mind, but left field, something, something else might be discovered. Yeah. So we think that's really important as well.
What do you think the barriers are to finding treatments beyond it, it being rare? What are the barriers?
Being rare is a really important point to a barrier, though, because what you have is a really small patient pool. So when you have clinical trials, you have a very small pool of people in order to go on these clinical trials. And if you are available for the trials, because you might not be, because they are quite taxing, some of these trials, infusions every 6 weeks, being in a hospital for 6 hours at a time. These are the things that some of the clinical trials are asking patients to do. Now, that's difficult, isn't it? If you've got trying to hold down a job, maybe you've got a family, you're feeling very fatigued, you might think, do you know what, that's just one step too far for me.
And I suppose it's worth stating that, as I understand it, it's quite rare to find someone in the early stages of liver disease full stop, because normally someone doesn't present symptoms until an advanced stage of that particular disease, right? Once
you're diagnosed. Some people do get diagnosed early because they go in for something else.
Yep.
And their blood tests show up, indications for PSC. But generally, you're right, people do come in with a more advanced stage. But the point about the small patient pool is, even if you are available to go on the trial and you want to go on the trial, then you might not be eligible to go on the trial, because a lot of the trials, you can't take certain drugs, which you might think, my itch is absolutely overwhelming. Somebody described to me itch under my fingernails. I couldn't get to it. Itch inside my head. I always remember this conversation. And she said, I wanted to get a knitting needle, stick it. She said, I was in that much agony with the itch. Now, if you've found a treatment to treat that symptom and it's gone away or lessened, you want to go on a clinical trial, but they say you can't take that drug, you're not going to do that, are you?
Yeah.
Or if you've just had a cholangitis attack, it precludes certain people from going on the trial. So small patient pool, not everybody can take part. It's not a heterogeneous disease. It's very diverse. So that is a really important point for the clinical trials. One of the other things is funding. As I'm sure you can imagine, funding for rare diseases is not easy to get hold of. There are pots of money, of course, available, but it's less than maybe cancers, if you can say that. But also the other thing is the lack of biomarker for PSC. There are no biomarkers currently that can test the efficiency of drugs and the efficacy of drugs or treatments for PSC. So that's a really important point as well.
How much of a barrier is this being a liver disease and potential stigma against liver disease? Because 90% of liver disease is preventable. It's caused by perhaps alcohol abuse or drug abuse. Obviously, in the case of PSC, that's not the case.
Not at all.
And there are a number of other liver conditions where that's not the case. But where you've got a rare disease, pots of funding, but perhaps disparate, as you've mentioned there, or fragmented across various different parts of the sector. Is that a barrier that you see as well as a charity, where perhaps advocating for the disease is trickier because of misinformation about the illness?
I suppose it's where you're advocating for the disease. If you're talking to the medical profession,
yeah,
or for medical funding, you can quite easily, put forward your argument and people accept that, because I think people do know in the medical profession or medical funding what PSC is, and you can explain it quite easily. I think it's outside of that arena where there's some difficulty explaining it sometimes. But you mention liver disease to a lot of people, and you can see the first thing they think, oh, what have you done to cause that then? You can see people's mind working in that way. Now, PSC, nobody knows what causes it, actually, but what medical professions think is caused is a combination of environmental and genetic factors. Now, how they integrate and how they react, nobody has quite figured that out yet, but it is certainly not the individual's fault.
When you talk about the medical community, obviously we're in the UK, so we generally talk about the NHS, but we said obviously this is affecting people all over the world. But when you talk about the medical community, is that also referring to private organisations? So where you've got companies who are investing in kind of drug trials or medical devices and so on, how much interaction is there with the private sector?
I mean, pharmaceutical companies, we talk to them all the time. So I talked to one in Israel quite recently, one in America. I talk to them, weekly, I would say, pharmaceutical companies. And there is an increase now in, as I said, the research landscape is flourishing. There's more clinical trials with pharmaceutical companies than ever before that we've seen. So I think they are taking notice of PSC now in a way that they've never done before. So that is increasing, and we are pushing it to increase even further.
You use an app to get information out there.
We do.
Great that people can kind of access that information easily on phones and so on. How are the patients, how are the community using that?
They're using it to track their symptoms, so that's really useful information. When you go and see you go and see your consultant, not very often. You have very limited time in front of that person, 15 minutes if you're lucky. So to track your symptoms in that way is really important information for that clinician. So they're using it to track symptoms. They're using it to keep information about their medical appointments, actually. Any questions they want to ask their clinician, they put them on that app. There is information, constant updated information on clinical trials, what's available for them to take part in. And one of the things we want to get to, we're just doing our second phase of development for that app. And one of the things we want to get to is patients inputting all of their information on that app. And then the app tells them what clinical trials they'll be eligible to go on. So just making it easier for the patient to identify the clinical trials. So they use it in different ways. We've got information on what to do if you have a cholangitis attack. We've got information for clinicians. When you go to a hospital, they're like, we don't know what this is, go home. But actually what it can turn into is sepsis. So we don't want that to happen. And there's information on that app to show to A&E doctors that this is what I'm having and this is what you need to do for me. So it's really good information. It's really important information.
And being able to track symptoms is really important. I mean, I know from personal experience, you kind of start overthinking everything that's happening to you and noticing changes that perhaps have absolutely nothing to do with the disease and are just you getting older.
Or not feeling particularly well that day.
Yeah,
you know.
but you find that you get to an appointment and you do perhaps forget stuff as well. I know that families say to me, no, but this has happened, and did you mention X? Did you mention Y? And because there isn't any set kind of route that this disease can take, you're second guessing all the time all of these symptoms. So that must offer people a lot of comfort to be able to put it down there and have that as some kind of almost like a logbook or a diary.
Yeah, definitely. It's just ease of access as well, isn't it? You know, everybody's using their phones constantly. And so you just go, oh, do you know what? I'll just stick that in now quickly.
Yeah.
It's really easy to use rather than I'll put it on a piece of paper, I might lose the paper, might lose my notebook. It was always there. So I think it's really good for people to be able to keep those, you know, that track of symptoms.
So what are the aims of PSC support? Because you've mentioned there you're 8 months into the role. Let's face it, the first few months of any role is kind of getting used to the community, to the organisation. What plans have you got for the year ahead?
Well, we've got some really interesting plans. So PSC support provides information and support that I've talked about, advocacy for patients and research. We're trying to push the agenda on research. We're updating our website. We've got some really exciting things that were going to happen on our website over the next year. We've got lots of information on that website. I mean, really detailed information, but not everybody can take in information in that way, and we realise that. So we want to move to an infographic type message on our website that people can just, you know, patient journey, so people can click on the patient journey. What should they be expecting? And they can watch maybe a video, maybe an animation, you know, different forms of the way that we're communicating our message to people. So we're doing that. We are increasing our information days to twice a year. So one in the north of the country, one in the south. So people can come to those. Now, when we had one in the north, we had people flying over from Ireland. Right. We had people from the, you know, southernmost tip of England. We had people from Wales attending. So we know the thirst for that information and for meeting other people is really there. So we're going to provide more of these days around the country. We are providing more Ask the Experts sessions so people can just dial in and just ask those questions. So we're taking care of that. One of the things when I joined, research, what's happening in research? People were asking me that question all the time. And I've put a marker in the sand now and said we are dramatically increasing our research funding as an organisation. So we're doing that this year and in subsequent years. So this year we're having 3 different funding rounds for researchers and clinicians to access pots of money for PSC research, which we've never done before. We've done it on an ad hoc basis. We've got a scientific review committee that, you know, goes through all of the applications and makes sure that they are the best research projects that we can fund. And the scientific review committee made up of patients. So they're looking at it from a patient point of view, but also PSC experts in this country. So we are increasing that, you know, that pot of money, if you like, for research. And we are going to fund a PhD fellow to do that deep work on PSC day in, day out, every year for about 3 to 4 years. PhD fellowships, I'm told, last. So we are really we're doing everything we can to increase and push it around. You know, we think there are effective treatments on the horizon. We want to push it around the corner in order to get those for people with PSC.
Very exciting. Well, look, I want to really kind of thank you for giving up some time and inviting us in. If someone does want to go to that website and find out more about the disease, pscsupport.org.uk.
Yep, that's right.
If someone wants to find out more. Well, look, thank you again for inviting us in.
Well, thank you very much for coming.